Now, is the behavior that they're engaging in and the possible consequences of that behavior, do they outweigh the risks that are inherent in every physical restraint? That's something to think about. Is there going to be an increased risk of injury if you use a restraint, or a decrease? The other thing that I always think about, because I've been part of many restraints, not a lot over the last year though, maybe one over the last year, which is really nice. But I have Brett talked about, I have a family member with autism. My little sister, who's 24, not so little anymore, but she has autism and a whole host of problem behavior, a lot of aggression, hitting, biting, headbutting, that type of stuff. And there were times when I was growing up when I would restrain her, and I wasn't trained. I'm 6 years older than her. So I'm thinking, this is what I have to do right now. And Mom's saying, don't restrain her, don't restrain her. And I didn't understand it at the time. Because I'm just trying to keep myself safe, right? And getting hit's not fun, especially when you're in a band. So now, anytime I'm even looking ahead and planning proactively about what the course of a behavioral episode might involve, if restraint's in there, I think, if I just took this person out and plugged my sister in there, and she's the one having these problem behaviors, would I feel all right if I watched somebody else come in and restrain her? That's a tough way to think about it. It doesn't have to be your sister. It could be, your kid. Sometimes if it's your spouse, it's like, well, whatever. Maybe not that. It's good to use a loved one in that position to really try to identify when is a restraint okay. It's not technically part of the curriculum, but it's something that's been really useful for me through my years of experience, and it's yielded good results. Again, risk of not intervening is greater than the risk of intervening. That's pretty much the criteria that they teach in the training. Always use the least restrictive procedure. Okay. One of the holds is here, and one of them is here. They're both high up, they're away from the diaphragm, but this is less restrictive. I think everybody would agree to that. It's almost always my go-to.